Syncope is simply another word for fainting or passing out, and is from a temporary drop in the amount of blood flow to your brain. Someone is considered to have a syncope if they become unconscious and then soon recover. Recovery after passing out is not guaranteed. If you pass out from a true syncope, you will likely become conscious again and alert right away, and you may feel confused for a bit. However, if you become unconscious due to a seizure, heart attack, head injury, stroke, intoxication, a blow to the head, or a hypoglycemic counter, or any other emergency medical condition, it is not considered a syncope, as in this case, it is highly likely you will not soon recover unless medical intervention is instituted. For most people, syncope would occur once in a blue moon, if ever, and it's not a sign of serious illness. However, in others, syncope can be the first and only warning sign prior to an encounter of sudden cardiac death. Syncope can also lead to serious injury, as passing out or fainting can result in you injuring other parts of your body. If you have recurrent syncope, talk to a physician. Before syncope occurs, there may be premeditating symptoms, and we refer to these as pre-syncope. The feeling that you are about to faint the moment before syncope. Someone with pre-syncope may be dizzy or nauseated. They have trouble hearing, experience palpitations, or feel weak and suddenly sweaty. The person may also feel drowsy, feel unsteady or weak when standing, and then there could be changes in vision, such as seeing spots or having tunneled vision. In tunneled vision, you lose your peripheral vision. Peripheral vision is your ability to see out of the corner of your eyes. You are able to see things outside your direct line of vision. So, in tunneled vision, you are only able to see what is directly in front of you and cannot see things on the side without having to turn your head. You may also experience, as part of the changes in vision, a visual grey out where colors become dim and you could start seeing in black and white. As part of the premeditating symptoms, you could also have a headache, so when you are discussing your syncope with your doctor, you may also want to note down these episodes as well. Syncope occurs when there is inadequate blood flow to the brain, and this could stem from a sudden decrease in blood pressure or changes in blood distribution. Your body may redistribute your blood, for example during exercise or after having a good or heavy meal. So after a good or heavy meal, your digestive system is very active, so your body would want to shift most of your blood volume to support your digestive functions. Also, during exercise, and more accurately intense levels of exercise, your blood distributes to your muscles and heart to support its function, and in this blood redistribution, your brain flow would be affected, and this could cause a syncope. Besides these causes, there are other potential ones as well. The common ones include having an arrhythmia, that is abnormal heart rhythm, and during these episodes, your heart works inefficiently and not enough oxygenated blood circulates to the brain. The syncope could also be the result of a trigger, and we refer to this as reflex syncope. Because of the trigger, your heart slows down and your blood vessels dilate, that is, they open up. This causes your blood pressure to drop, affecting blood flow to the brain. It is not always the case that syncope will develop. A pre-syncope can also occur. Some of these triggers could include seeing blood, getting an injection, or having blood drawn, most likely when a good amount is taken at a blood donation, standing up quickly or upright for a long time, a sudden or unexpected stress or pain such as being hit, which could be at any part of your body and not just your head, coughing, sneezing, laughing, defecation or urination could also cause syncope. Dehydration, where in dehydration you have a decreased volume of blood entirely, so then blood flow on a normal to your brain is affected. Intense emotional stress, anxiety, fear, pain, hunger, use of alcohol or drugs, breathing in too much oxygen or breathing out carbon dioxide too quickly, what is referred to as hyperventilation, could also cause dizziness or fainting. Turning the neck or wearing a tight collar could also expose you to having a syncope. One other cause I would like to delve into is referred to as orthostatic hypotension. Orthostatic meaning upright position, hypotension meaning low blood pressure. So in orthostatic hypotension, your blood pressure reduces in an upright position. How does this happen? When you move into a standing position, gravity pulls blood to settle in the lower part of your body. Under normal circumstances, your heart and nervous system is able to detect and correct this affected blood pressure to keep your pressure stable. But in orthostatic hypotension, due to some reasons, your corrective systems are faulty, and this causes the blood to stay low, quickly reducing your cerebral perfusion pressure, and this will most likely happen during a quick change into the upright position. Orthostatic hypotension is common in the elderly and often exacerbated by 1. Dehydration, and 2. Medications that lower blood pressure. If you experience syncope during certain activities or in connection with certain events, you may want to do them at different times or differently. For example, toning down your intensity of physical activity or not engaging in any physical activity after a heavy meal, wearing loose collars or loosening the necktie if you have to. If you experience syncope from orthostatic hypotension, try and take your time when moving from a lying into a standing position. It will be better to transition with a sitting position before standing. If someone faints or is having a syncope, they should be moved so that they are lying down with their legs raised to promote blood flow to the brain. And if they do not regain consciousness promptly, you may want to check the pulse and breathing so as to know when to start CPR if necessary. You may also want to avoid triggers as mentioned, and if it reoccurs, I advise you to see a doctor. There are many diagnostic procedures and treatments for people who experience syncope. It is not always the case you may have to see a doctor. If it is persistent, a doctor will know what is best for you in terms of diagnosis and treatments.